Okay. Hello to everyone. My name is Nino Sharashenidze. I'm the Dean of Medical School at East-West University. As well, I'm the head of the medical service at Aleksandre Aladashvili Clinic, which, as you already know, I'm sure, it is the main base of university. So I will give you a short, detailed information about this clinic. This clinic counts over a century history. So whole this period in this clinic were old generation giving and transferring the skills and experience to the newer generation. Generally, it was a university clinic, so it is not new in this clinic to give this whole information to students. So we are more than pleased to continue this tradition, you can say. And I will give you a short tour in our clinic, which will give you better visualization what we can offer in this clinic. So when the students arrive, we are splitting this whole group into 5 members, and each group is entering different rooms in this clinic. When they have the ER department course, I mean emergency, they of course need to see how is done X-ray, how is done ultrasound examinations, and so on. So let's go inside and I will show you where it's happening. Let's hope there is a patient, please. Patient, no. Yeah, sure. Unfortunately, no, it's not the procedure. It is like 2 or 3 students will stand here. They will have opportunity to watch over the window and see how this procedure is done. Okay? We have X-ray machine, which is here is the workstation for them. Here is ultrasound, abdominal part and cardiological part. Unfortunately, there is a patient, so the same is happening in, I guess, cardiological. Same here. Quenara. Quenar გამოჩნდებით ინდოეთისთვის არის. ინდოეთისთვის quenar გამოჩნდებით. Okay, continue. Now we should enter ER department. Generally, on the whole course, when the students start to visit our clinic, it is happening at the first year. At the end of the first year, they are just adjusting to the facility, how does this medical documentation goes, to how to perform the Form 100, and they are just getting used to this environment. Of course, they will have opportunity to enter the consultations, and after the first semester of the second year, they are already starting to go to the ER department, where they will have opportunity to observe the patients. There will be different cases. We have like in 24 hours, the amount flow of the patient is over 50. It is just for the ER department, but of course, through the year, we have like patients flow. It goes more than 10,000 per year. This is ER department. We had a little pause, but we shall continue. Here we have different rooms, room for shock, room for observation. Here are a different type of patients, and offering that amount of patients, we can provide our students with all types of the patients. Let's see now, here we can, yeah. Cardiological patient, yes, you can. One is neurological patient and the second one is cardiological. Ikita darbasshi რა ხდება? მიბეწებს? დავაწყარ ბოლოში. ბედი. ერთჯერადი ხალათი მათხოვთ ის გითო გავიყვანო. Come. I would like to show you as well the small operating room we have here. It is like for emergency cases, just to put on stitches, to remove stitches, to clean the wounds, or put on the, in case of traumatological patients, here. This is just for small emergency procedures. Here is just to wash the hands, the space, and here is itself, as you can see, small operating room. It is loudly spoken, not operating room, but still. Okay. Then we have here as well CT scan. Pacientia. So they're now, as I see, they're discussing the case. Heta, привет.
So guys, what can you see?
Let me open this. This is CT scan. Now they're just taking the picture of the images. He's explaining what parts of the body is seen on that images, just to have a brief imagination what they are looking at. We should proceed in the... Okay, after the ER department, we're going to ICU department. It means intensive care unit, where our students also will have opportunity to see how the medical examination of the ICU department patients is done. As well, we can quickly skip here as well, because it is the one of the rooms of the emergency unit. So, at this case, we have two patients here. I'm not sure what they are treated by now. Please. This is ICU department. Come. ჭირდება. We have some parts of ICU department, 1, 2, and upstairs is well the third one. You can take a quick peep here, but please do not enter very closely. Come here. Come. And this way you can record. There is as well beds. Okay.
So we have 3 ICU departments.
Yes, yes. One room, the second one, but there is as well another one, and the third one is upstairs on the 3rd floor. Yeah, okay. Now we can go upstairs at therapeutic department and cardiological department. We might record it as well, and at the 3rd floor, operating rooms is interesting, and laboratory as well. Now we're going on the second floor. Let's see there. We're in the middle of the renovating process. We are adding the fourth floor here. So now at this point, total number of our beds is approximately 140 beds. But at that point, when the fourth floor will be done, we will have like over 200. Let's use stairs. It is much faster. ეს კარები რო გამიხოთ კარდიოლოგიის არ მაგჩი. ბატლობა ესე ჩემოვიდეს. This part is for otorhinolaryngology. Students as well will have the rotations in this subject. And this part is for cardiology. Here are inpatients. I will show you the pallets. Please. გამარჯობა. Just record it from here, but do not enter. Here are cardiological patients. The same everywhere. Okay. In this part of the building is catheterization laboratory for cardiological patients and as well intensive care unit only for cardiological patients. Procedura. Okay, hooray, it is a procedure. We can record this as well. Come here. Yeah. Procedure is going. You can record it from here. Here, stand here. For stents. Catheterization laboratory for stents. The coronary arteries do not work properly. We put stents there to improve the blood supplement in the heart. Cha'itka stenti? Რამდენი? Afterwards, when the patient is done with this procedure, they stay for 24 hours in the intensive care unit. I will show you as well where. Just Hodi, come. This part is for inpatients, for cardiological and therapeutic patients. Gigarago racha. Just pellets. This is intensive care for the therapeutic patients. Okay. And here are just rooms for the doctors. Okay.
Department. So I think
This is Dr. Aladashvili. He's the lecturer in general surgery for our students we have just met. So he will tell just 2 words about the students, what kind of impression you have about your students and what are their expectations. Are they done or no?
okay. Our students are so happy because they have possibility to be in our clinic, in our department. They have possibility to see nice surgeries with theoretical and practical parts. They are improving their skills in surgery. So what more?
What are now they doing,
They are now in radiology department. They are looking CT scan results of the acute patient. You can see they are writing reports from CT scans, and we are explain what kind of radiology results we have. Okay?
Okay, these are operating rooms. At this point we have 4 operating. 1, 2, 3, 4. No, 3. რამდენი საოპერაციო გვაქვს? რამდენი საოპერაციო გვაქვს ჩვენ? 3. At this point we have 3 operating rooms, but at the 4th floor we will add more 8 operating rooms there. So we are not allowed to enter, unfortunately, there. You can come just here. Here is going operation now. And there is post-operating intensive care units. 1 here. And the second here. This is for cardiosurgery. Little closer, come. And this is for general surgery, which we already have seen. After the surgical treatment is done, the operation, they put patients for 12 hours. It depends upon how the operation went. And after this post-operative room, they're transferred into the pallets. But students, of course, will have opportunity because they will be dressed properly. They can enter everywhere. As you already heard, Dr. Shalva is letting them to attend each day at 2 operations. Okay, that's the end of our tour. To record this building is for lab. Okay. You can record this as well. And there is this fourth floor scene from here. It is already done. We're starting in process already, renovating of the inner space. This is lab. At this point we're doing here biochemistry, hematology, immunology, and from the end of the April we are adding as well bacteriology. Please. ABG. Urine tests. Gamach. Nino saitare. Naxave xarje daasrolოს და biochemistry, hematology, immunology, coagulation. This is immunology. Okay. Upstairs we have as well one classroom for the students at this point too. They're just discussing CBS and PBL. Case-based learning is provided here by the surgical lecturer. Each day they're seeing like 2 or 3 operations they're entering, and as well they're discussing the surgical patients which they have observed. So let me check if it is open. I guess it's closed and I do not have my keys with me. Let me ask the keys. Here is morphology. გასაღები ერთი წამი რომ მათხოვოთ და ეხლა მოგცემთ. როგორ ხარ? ერთი უცბად გავაღებ და ისე დავკეტავ და კი, მაგრამ წაიღეს? ეხლა იქ არიან ზევით.
მე არ მაქვს, იქ არ ვიცი თუ დევს.
აქ აღარ დევს ერთი? ხო იდო. ადრეს გაიტანეს?
ხო, აბა ნახე, ბექა იქ ინსტრუმენტი ატარებს ლექციას.
ბექა.
იმას აქვს.
კაი.
მეტი არა მაქვს. ტუალეტის მაქვს, ტუალეტი რაღაცა აუდიტორია არა მაქვს. ერთი იყო და აღარ ვდივდი ტუალეტში.
So it is the end of our hospital tour. I hope you will enjoy it. I hope we will approve your expectations when you will decide to choose our university. And hearing from you soon, I hope so, and we will meet in person very shortly. Thank you.